Hey, my name is Kara. I'm an ultrasound tech, and let's talk today about why we don't do more scans in the first trimester to confirm viability and see how the pregnancy is going. And before I get the video started, go ahead and check out the link in my bio for my new group for current as well as expecting mums. That is a great place to get more information on ultrasounds as well as just have a supportive community for pregnancy. So, anyways, if you're interested in that, go ahead and click on the link and hope to see you over there. So, this question is a little bit of, I guess, a convoluted answer as to why we don't really do more scans in the first trimester. But essentially, you can think of it as a risk versus benefit analysis. Ultrasound does not come without risks. And although, in the way that we use it for medical purposes only, so basically when we use it as intended, there have been no proven risks or no proven adverse side effects. But in saying that, that doesn't mean that there are none. Just because there hasn't been any proven yet doesn't mean that the side effects are none, which is why, in Canada anyways, we try and limit exposure as much as possible. In the first trimester, usually what we do is a scan around 7 to 10 weeks, and then another one at around 12 weeks if you are wanting the NT done or the genetic screening done. But otherwise, you're not going to get another scan in your first trimester. This can obviously be really worrying, especially for first time mums or if you have had a miscarriage in the past. This user also brings up that she is really scared of having a missed miscarriage, which is where there is a miscarriage, but then there aren't any symptoms that go along with it, like the usual pain or heavy bleeding, and that's totally understandable. But I guess the long story short is we don't want to expose mom and baby to ultrasounds more than necessary. And in the first trimester, there's really not anything, unfortunately, that we can really do, even if we do see an issue. And if we do see something that is amiss, let's say there is a really large subchorionic hemorrhage, or let's say baby's heart rate is a lot lower than what is expected, it's not like we can really do any sort of medical intervention to make sure that these issues are resolved. And although we do closer monitoring on these pregnancies that we see any sort of issues with, when you are having a first scan that has no issues with it, we are not going to then scan you every week, let's say, just to make sure that it is still normal. Because in most instances, if we are seeing baby from about 7 weeks onward, the risk of miscarriage is a lot less than, let's say, if we were seeing you at 5 or 6 weeks. And therefore, we are not going to, again, expose you to more ultrasound than what is necessary just to ensure everything is going okay in the first trimester. Also, it is a funding issue as well. In Canada, healthcare is technically free, even though we do all pay into it. So the cost of ultrasound is going to really go up astronomically if we are going to be adding in all of these extra ultrasounds, especially when, again, it is not technically medically necessary because there were no issues seen. So that basically sums it up as to why we don't do more scans in the first trimester. And I know, again, as someone who has experienced like miscarriages in the past, or if you are a really anxious first time mom, that can seem pretty callous. And also, you really want to see baby and you really want to have that peace of mind as to knowing whether or not things are progressing correctly. And hypothetically, you could do that kind of if you were getting scans, let's say every week. But I think something important to really keep in mind is that getting those scans on a very frequent basis, again, does expose you to more ultrasound than what is medically necessary. And quite frankly, we haven't been able to ethically do studies on where that limit of safety is with ultrasound. And especially in the first trimester, when there are so many tiny, tiny cells being developed every single day, if we are exposing those tissues to ultrasound, which has been proven to heat up tissue to some degree, we don't really know. Like, at what point does that go ahead and cause any sort of issues if we are scanning on a very regular basis when there is really no medical reason to be doing so? And again, that's not to say that we aren't going to monitor more closely if we do see something that is worrisome in the first trimester, like that low heart rate or a subchorionic hemorrhage. But for the majority of cases, we are not going to be needing any sort of follow up until you get your next routine exam. And even if you were getting, let's say, weekly ultrasounds, that is going to ease your anxiety. That's only going to ease it for that amount of time that you are looking at baby on the screen, if that kind of makes sense. So obviously you are really anxious going in because you are worried that there is a miscarriage. And sure, when you see baby on the screen, you are going to be like, oh, awesome, there's baby. I'm really reassured now. But pretty soon after, which again, this is from my own experience with talking to patients, pretty soon after, that anxiety does come back. And again, it's not really going to go away until you go ahead and get another scan. And it's kind of this vicious cycle. So, a lot of the time, from what I have heard, if doctors do have patients who are really high anxiety or do have the history of loss, instead of just ordering more and more ultrasounds, which again is not medically necessary, and obviously exposing mom and baby to more ultrasound, they are going to maybe talk to the mom about these potential causes of where this anxiety is coming from and treat it at the root cause of it instead of just treating the symptoms, as in just throwing more ultrasounds at the patient. Anyways, I guess that wasn't really a short response to this, but at the end of the day, that is why we do not have more than what is the regular scheduled ultrasounds in the first trimester. Again, we only really do the dating ultrasound as well as the optional nuchal ultrasound in the first trimester, and that's it. And then your next scan is going to be in the second trimester, that anatomy scan. And if everything is fine at that one, you aren't going to get another scan at all in the pregnancy unless something comes up in the third trimester or if we need to follow up something that we saw in the second trimester.